Hi, I'm Tom Donahue, CEO with BROC Community Action. Welcome today to this important forum hosted by Rutland Regional Medical Center here at PEGTV and live as well on all Catamount radio stations. We're so appreciative of the opportunity to bring you important information about how Rutland Regional Medical Center is standing ready to assist this community to deal with all of the issues around COVID-19, the coronavirus. It's on everyone's mind in Rutland County right now. It's on your minds, it's on our minds. And we're very fortunate to have both local radio and local community access to help fill us in on the outstanding efforts at Rutland Regional Medical Center, one of the Rutland region's greatest assets. Along those lines, we have some great leaders at the Rutland Regional Medical Center, two of which are with us today. We have, of course, the President and CEO of Rutland Regional Medical Center, Claudio. Claudio, welcome. We appreciate you being here today.
Thank you, Tom. Thanks for helping us get this message out to our community.
And Dr. Rick Hildebrant, Medical Director of Hospital Medicine. Dr. Hildebrant, thank you for being here today.
Thanks for having us, Tom.
This is very important information we want to get out to the entire community right now and let you know what's happening today in addressing this issue in the Rutland region. You've heard it nationally, you've heard it statewide, and now you'll hear it locally. To begin, I'll start with Claudio Fort, again, President and CEO of the Rutland Regional Medical Center, and ask one of those questions that's probably most burning on your minds right now. How prepared is the hospital for COVID-19, and what measures have you put in place?
Yeah, Tom, thank you. We've been doing an incredible amount of work over the past several weeks to prepare our hospital as well as we can for the COVID-19 coronavirus public health crisis. And you probably are starting to see some activity outside of the hospital when you go by. We've restricted visitors. We've moved very quickly, and now the governor signed an order, an executive order, the end of last week that has mandated all hospitals and nursing homes to restrict visitation and to limit public gatherings. He is doing exactly the right thing, and we have moved very quickly to do that, and we put that in place this week. We're postponing and rescheduling all non-elective procedures as quickly and safely as we can put those off. Your doctors are looking at, and your medical professionals are looking at your medical information, and if they think that we can put this procedure off, some of you have been called already, and we're calling you to ask you to postpone that. And the reason we're doing that is to make sure we have the capacity, if you have an emergency situation, that you will be taken care of. Everything we're doing at this hospital is making sure that we're ready and we're still able to be, no matter what happens, to do emergency surgeries and to take care of you when you're critically ill. We're managing our personal protective equipment. We're hearing a lot of stuff these days about shortage of masks and so forth. We've amassed everything we could, and we have strategies in place to preserve those and make sure that there's enough to protect our caregivers and to protect you, our patients. Testing. There is a lot of things that we might ask you to not do for testing. The whole thing is, if you don't have to come into the hospital at this point, don't come in, and your doctors will help manage that. Also, you're going to see, and you've probably seen this morning, some tents going up outside of the hospital. We are putting those up because we've been doing COVID-19 testing outside of the hospital for about a week now, and we're going to expand that for other testing. So if you have to have a blood draw or regular testing, we want to be able to do that outside of the hospital, not have you come inside of the hospital to do that. We think it's safer for you, and we think it's safer for the hospital and those patients and staff in there, and it'll help preserve the operational capability of our hospital. So we're working on that, and that should be up and running either Friday or Monday. Our staff have been working nonstop, putting plans in place for how we would take care of patients if we have a big inflow like what's happening in other parts of the country and in northern Italy. So we've learned from some of those situations, and they've helped inform our planning efforts. And then for our employees, we're reassigning employees. We're getting as many of them to work from home as possible. And I would ask our business community to do the same. Dr. Hildebrandt's going to talk to you a little bit about why that's important. But really what we're trying to do is get everybody to isolate and practice social distancing. This is the strategy that has worked in Italy. This is the strategy that has worked in other parts of the country. This is why Governor Scott has taken unprecedented and quick, decisive action to help us do that. And the quicker and the broader we can do that, the better we will be. And so basically, Tom, everything that Dr. Hildebrandt and myself and the other leadership team at the hospital has been doing has been informed by three main principles: protect our patients, protect our visitors, and to preserve the operational capability of Rutland Regional Medical Center.
Along the lines of the testing, I did want to ask if the folks coming, so this is from national, and I'm assuming it applies to Rutland too, but everyone should be referred first.
Thank you for that. That is a big concern, and it's a lot of confusion among people. The challenge for us is we don't have enough tests, and we don't have access to enough tests. Despite the incredible efforts of the Vermont Department of Public Health to get those, we still, our doctors don't have enough tests at their capability. So they are just using those tests for those patients they think it's most important to. You can't just drive up and get a test at Rutland Regional or any hospital. And the testing is controlled by the Department of Health and the CDC. And another thing is, we are not doing the testing right locally at Rutland Regional Medical Center. We wish we could do that, and we're looking to see if we could build that capacity. But as of today, the only place that does the testing is the state health lab for the State Department of Health. And we are the collection station for that. And so I think some people have a lot of misconceptions that, you know, they've gone to work and they think they might have been exposed, and their employer says, you can't come back to work till you get a test. Unfortunately, we wish we could do that, but it does not work that way.
That's excellent information. And just one other follow-up on that is regarding the referral. I'm assuming when they pull up in their car, they would have the referral to provide, and it would be officially from their primary care physician.
Yeah.
Is there anything else? Would they need a driver's license or anything like that?
No, I don't think so. Dr. Hildebrandt?
No, so the testing collection process, as you said, is primarily driven by the patient's medical care providers or their primary care physician. They'll call the office of their primary care physician, and the primary care physician will make a decision as to whether or not testing is indicated based on an algorithm that we have developed for our region, which includes both symptoms and the risk of exposure, who has caused that exposure to you. When that discussion occurs, the primary care physician will fill out the required forms, and sometimes it's a phone call to the hospital, and let them know that a patient is coming in for testing. So we are prepared to receive that patient and provide that test to them. So the process is seamless with our outpatient community providers to make sure that we have a good information flow. When the test has been collected, as Claudio has indicated, it gets sent from our facility to the state lab for an evaluation, and the results of that then come back to Rutland Regional. We, through our lab, will communicate that information with the ordering provider. So the information really goes back to the person who made the initial decision that a test should be collected, and the ordering provider, in this case oftentimes a primary care physician, will communicate that result with the individual who was tested.
And just one thing on that, don't show up at the hospital, but also just don't show up at your primary care provider
Right.
looking for a test. Call them first, and they can go over your signs and symptoms with you and take their advice. And we have been working very closely, the hospital and our community primary care physicians have been working very closely on this protocol.
Excellent information. Very much appreciated. Thank you. So Dr. Hildebrand, in hoping that we don't get this, of course, there are steps we can take. I wanted to ask you, how can I protect myself? How can I protect my family? And how can I protect my community? And I know that's kind of a three-part question, and there's probably three answers, but I
Right.
think that's on people's minds.
Right, and that's true. There's a lot to that question. So I'll break it out a little bit. So I'll start with how can we protect ourselves. In that category, the single most important thing is to live a healthy lifestyle. To live a lifestyle that's free of drugs and alcohol, to exercise regularly, to eat healthy foods, to get a lot of sleep, to keep yourself hydrated. Those things will keep your immune system healthy so that if you are exposed to this virus, it's a mild virus and you clear the infection without any need for emergency services. That is the single most important thing that one person can do to keep themselves healthy during an exposure interval. The other thing that is very important on keeping ourselves healthy is to focus on our mental health. Anxiety is at an all-time high right now, and we need to realize that. We need to take some time for either meditation or deep breathing. Individuals who have a counselor or a therapist and are struggling with anxiety or depression should be encouraged to call them. Do the things that you do to manage your stress level. Reach out via phone to your friends and loved ones. Communicate. It's really important for us to all be focusing on our mental health because the anxiety level right now can't be underscored, and it's important to focus on that aspect of our health. In terms of keeping our family safe, social distancing is really the single most important thing to keep our families safe. We really should be living by that precept, which means don't be leaving your house unless you really need to. Do you have an urgent medical appointment? Do you need to get supplies like food or other emergency supplies? Or do you need to get prescriptions? If you do, of course, you should leave your home and do those things, but otherwise you should be staying home. And that will reduce your risk of contracting the illness and bringing it home to your family. So social distancing also, as you'll see in the studio here, we're staying 6 feet away from one another. That's a really good measure to take to try and prevent the spread of this illness. A lot of us in America, we greet each other with a handshake. We shouldn't be doing that right now. We can do a virtual handshake, we can do other means to greet each other, but we shouldn't be shaking hands. We need to wash our hands anytime we are in a public space. If you do have a cough or a cold, don't cough into your hands. And if you have a mask that when you're in the public area, like if you go to a medical appointment, you may be asked to wear a mask. You should do that to protect others around you. So that's to keep your family safe. We want to limit exposure to yourself and bringing it home to your family. And then how to keep your community safe. It's some of the things that Claudio touched on. We have to conserve the resources that we have. The hospital is well prepared, but we don't want to overwhelm any one aspect of our system. If a number of people presented to our emergency department asking to be tested when they had mild symptoms, that could easily tax our emergency services, and that could be detrimental to our community as a whole. Have understanding that things are operating in a different capacity than they have been in the past. We are in an extraordinary place as a community and as a country, and we ask for everybody to have understanding that things may be running in a different way than we have in the past. We're not allowing visitors to most of the patients in the hospital. That's a change, and we ask for your understanding in doing that, and that's really important to help our community safe. One other thing I'd mention, being in Vermont, we're really very lucky that we have this wonderful resource of the outdoors that we can draw upon. When I say you should be thinking about when you should be leaving your home to go to these visits, that doesn't mean that you can't go for a walk in the woods, go on a hike in the mountains. I would encourage that strongly, and that's such a wonderful resource that we have in Vermont, and we should take advantage of that. That's not true in every place in our country and in our world, and that is really a great thing for not only your physical health but your mental health as well.
So one additional question within that great information is if you are healthy, do you need to wear a mask?
Right. So if you are healthy and do not have symptoms of a cold, then wearing a mask is not going to prevent you from getting an illness. And if anything, it will increase your likelihood of touching what we call your T-zone. Your T-zone is the area of your eyes, your nose, and mouth where touching that region can cause you to contract illnesses. And when you wear a mask, oftentimes it can be itchy or uncomfortable, and when you adjust it, you are touching your T-zone. So if you are not ill, do not wear a mask because that could potentially expose you to illness.
Wow, and that's such a great piece of information. I had never heard T-zone and had thought of it that way, and it's such a great way to remember that. Excellent information. For us neophytes out here
Sure.
that don't know what you know, this is fantastic. So thank you so much. So Claudio, I did want to ask, in addition to your preparedness, there's a lot of talk out there right now, of course, about what it means to flatten the curve. And I didn't know if you could talk about that a little bit, what the repercussions are if we don't.
And again, this goes to what Dr. Hildebrant was urging people to stay at home. The challenge and the big fear and the big challenges we've seen in Italy and now in our country is this virus spreads so quickly that it will spread to enough people and enough people will get sick and they will overwhelm the healthcare system. If a bunch of people, and most, I'll leave this to Dr. Hildebrant to talk about kind of, a lot of people will not have significant signs and symptoms of the illness, but it is so prevalent, it spreads so fast that even if a small number get critically ill, the nation's healthcare systems do not have the resources to take care of that many critical ill people at the same time. So social distancing lessens the amount of contact of the number of people that catch it at the same time, and it kind of flattens the curve. We can handle a flattened curve. Where we are really concerned about is that spike. And that's where we can't do it alone. As much as we've worked, the whole hospital has been fully engaged, all in to protect the community and protect our patients and protect our employees. We cannot do it without the public's help. All of those things Dr. Hildebrant said. If you, and some of these things are things that yesterday were normal, that today, you don't even think about as the seriousness of this situation hits us, like going to the hairdresser. That is probably not the time to do it. And we're all concerned about our local businesses and our local friends and neighbors that run local businesses, but it will be much better for them in the long run and for all of us in the long run if we do this now and we don't wait. Because this might be coming down the pike for us as it has in other areas, and if Rutland and our communities and Vermonters can get ahead of this more quickly, it will be better. And for our hairdressers out there, stock up on hair dye and so forth, because we're going to need it in a couple months when we get through this. So you'll rest up because you'll have some work to do ahead of you.
Yeah, and I couldn't disagree with a single word of that. You absolutely are 100% correct, and I hope people will finally get that message, because it's so concerning when we see people not doing what they can to make that difference for all of us. In case you just tuned in, I'm Tom Donahue, CEO for BROC Community Action. We're here hosting an important forum thanks to the Rutland Regional Medical Center. We're broadcasting live, of course, on PEGTV, all stations, PEGTV first, 15, 20, and 21, right here in your community access, as well as all 5 stations at Catamu Radio. We're so appreciative. This is such significant information and coming right from the Rutland region. We've heard it from the national level, we've heard it from the state level, and now we're hearing it right from Rutland Regional Medical Center. So I want to again thank my guests before we move on to the next question, again to remind folks who are listening to Claudio Fort, President and CEO of Rutland Regional Medical Center, and Dr. Rick Hildebrant, Medical Director of Hospital Medicine. Thank you again both for being here to answer these questions today. I did want to ask, and I'll start with you, Claudio Fort, we're worried about you too. And what are the hospital, is the hospital and hospital employees doing to keep yourself safe?
Well, we're trying to listen to our doctors like Dr. Hildebrant, and we're checking on each other, and we're really pulling together, but that's a significant situation. The people on the front lines at your hospital are under a lot of stress and a lot of attention, trying to make sure they're doing everything we can to keep you safe. And we're actually bringing in some folks to help us with that. We're assembling a team of folks to help kind of be there and provide a little escape valve. And I think some of it is just the little things. Be a little bit kinder with each other. You know, everybody is under incredible stress. Be a little more patient. Find a safe place that someone you can partner up with, and a safe place where you can talk about what's going on. Because we've all suffered some incredible losses over the past week or so, as we see how the world is changing. And yeah, I also want to say outside of the hospital, and this is to, you know, we've all got our students back home with us, and my son is home from college, not where he's wanted to spend. He said, Mom and Dad, I love you guys, but this was not where I wanted to spend the rest of my junior year of college. And you know, our high school kids and our college students, they feel like they've been robbed, and you know, it's very difficult for them. But for them, I would just say, this is your time too. I know this is a challenging time for you. We need your help. Although you are at a low risk profile, you can really help us. You know, we're going to be doing a lot of stuff from home. Some of your parents are home trying to figure out how to work from home. This is where you can help us figure out how to do this, technology and so forth. You will figure this out and you will help us get through this, but we need you to follow those rules. Don't get together in big groups. Don't go to big parties, folks. There'll be time for that. You really need to help your community and help the hospital and our doctors, your parents and your grandparents, because the actions you take can really be significant and impact us. And I know you will come to the fore and really help work with us on this.
So Dr. Hildebrant, one other question regarding the treatment. You guys are testing, and how do we clarify for folks watching and listening, you know, what are the symptoms that they should be aware of, but also maybe what are the symptoms they may not worry about? Because certainly you start to feel like I'm talking as a regular guy
Sure.
for a second, and say you start to get a cold and you think, uh-oh, do I have it?
Sure.
And there's maybe a lot of concern out there, and
Sure.
I hesitate to use the word fear, but it's, you know, verging on that with some folks, and I understand. And then also, how do we go about treating it?
Sure.
If, for instance, it is suspected that we actually have it.
Right, so the first thing to say is this illness for many people will feel very similar to a cold or the flu, okay? 80% of individuals have fairly mild symptoms. So symptoms, the most common symptoms that we've seen reported are a cough, especially a dry cough, and a fever. There are a number of other symptoms that people can have, but those two are the most prevalent within this illness that we've seen. And again, for most people, it will feel very similar to a cold or a flu, and you should treat it as a cold or the flu. You should hydrate, you should rest, you should keep yourself healthy, you should stay home. For some people, they get a very serious infection with this. They develop shortness of breath, the inability to breathe. Those are concerning symptoms, and those are the type of symptoms that you definitely want to at least call your doctor. If you cannot breathe, you should come to the emergency department for evaluation, okay? The treatment in the emergency department is very similar for many types of respiratory infections. We provide supportive care, things like oxygen, things like sometimes mechanical ventilation, fluids. The body, there is no directed treatment towards COVID-19. There's no antibiotic, if you will, that will cure us of this illness. It is supportive care while the body recovers from the illness. The immune system takes care of the illness. So supportive care in the hospital for the body to heal is really the main treatment. There have been experimental types of things that have been occurring across the country. To be honest, those things are not going to be ready in time to really treat patients. The treatment is the same treatment we provide for many people who have respiratory failure.
And, please,
I
Claudio.
just have kind of along with that.
Please.
There's some people who are contacting the hospital who are starting to get nervous. Do we have any COVID-19 cases in the hospital? Are they in our community?
Right.
And I got to tell you, the hospital's role is to take care of you and protect your privacy as well as your medical information. There's going to be very limited information we will be able to give out on that. For the same reason you wouldn't want information given out on you or your loved one, we take that responsibility very seriously. The Vermont Department of Health, who we're working with in lockstep on this, is the agency that is monitoring that and tracking that and reporting that, and where those cases are in Vermont. And now the other thing is, I got to tell you, I know that's a lot of fear, but those positive cases are not the cases that we should be worried about, because they're either going to be in the hospital and we know how to protect ourselves and take care of them and protect our staff on that, or they're going to be in the community under doctor's orders and being monitored by the Department of Health to stay at home and recover at home, as Dr. Hildebrant said. The ones that we need to be concerned about are the ones that are out there now, and some of us have this and we don't know, and we're spreading it before we show symptoms. And that is exactly why it is so important to practice the social distancing. Stay at home. So the biggest part of this, if you want to protect yourself and help slow the curve, as Tom said, is to stay at home, don't go out to appointments, let's wait it out for a while. Take it a week at a time. So
that's fantastic information, and a perspective that I truly appreciate, because I hadn't thought of it myself, and when you put it in that perspective, it makes perfect sense, and I appreciate you sharing that with our viewing and listening audience, because that's an important message. Also, something that has come up, Dr. Hildebrand, I wanted to ask, because you mentioned a couple of times now, and I believe in this, hydrating.
Yep.
Because there was even some information put out by the City of Rutland, Department of Public Works, shared by the mayor and so forth, that the city water is safe to drink.
Yep.
We also have a region here, and this is Rutland Regional Medical Center. So, of course, there's other municipalities, but I'm making the assumption that drinking the municipal water is okay.
Yes.
And that, I see people coming out of the grocery stores with carts and carts of bottled water. I don't believe we're there, but again, I'm the,
right.
I'm not the doctor. So.
I think there's a lot of people who are anxious and they're not sure what they can or should do, and they're appropriately trying to prepare. But our water supply is perfectly safe. I would encourage you to drink tap water. Me and my family do, and there's no problems with that. There's no need to stock bottled water. That's not going to serve any good use at this time. So yes, keeping hydrated is important. When we get sick, that is one of the things that can happen, is dehydration. When our body, when the immune system starts activating, that is one of the very first symptoms that we see as medical professionals, is dehydration and low blood pressure. So keeping yourself hydrated by drinking water is very important. You can go overboard. You don't need to drink gallons of water a day, okay? 2 liters of water in a 24-hour period is a good recommendation for the amount of water a typical person would need to drink. If you're sick, you may need to drink more, but don't drink 5 gallons of water a day either. That could be dangerous.
And there's one other question I wanted to ask, and it refers to topics you've brought up about how you're collaborating. So a lot of people have their primary care physicians and providers,
Yep.
if you will. And my last thought for today is, how are we collaborating with them? So if people are communicating through them,
Yep.
If you could kind of explain how you're collaborating with them.
Sure. So we are very lucky in Rutland, Vermont, that we have such a close-knit medical community. The hospital works very closely with the primary care practices across our region. We have been regularly meeting over years with our primary care partners. We've also regularly meted for years with other healthcare partners like our VNAs and our nursing facilities. We have increased the amount of communication through those venues to make sure that we are on the same page. Things are changing very rapidly, and we need to make sure that we communicate well with our healthcare partners. So folks like Don Ruther, the CEO at Community Health, and Brad Berryhill, their medical director, we have been in regular communications with. I have spoken with Brad Berryhill pretty much every single day for the last 2 weeks to make sure that we are communicating regularly about care, not only in the primary care sphere, but in the nursing home sphere and every aspect of care that we can have. We've been working very closely to develop testing protocols, to talk about what patients we need to care for in the hospital versus which patients we need to see at urgent care. That's something we didn't touch too much on here, but we have worked very closely with Jen Hansen, who's the medical director of urgent care in Rutland's Community Health Urgent Care Center, and they're well prepared to both triage and care for folks who have mild to moderate symptoms. And we would encourage folks who have mild to moderate symptoms to call their primary care doctor for help and guidance. If you don't have a primary care doctor, call the urgent care center at Community Health for help and guidance. They're very well equipped to deal with this.
I want to thank today Dr. Rick Hildebrant, Medical Director of Hospital Medicine, and Claudio, President and CEO of Rutland Regional Medical Center. This has been such amazing, powerful information today that answers a lot of local questions on this national and international issue. And I can't thank you enough. I want to give Claudio, President and CEO of the Medical Center, a chance to make some closing remarks today to you, all of our listeners and viewers today who have the same concerns and are watching.
So yeah, thanks, Tom, and thanks for this opportunity to talk to you and the community. It's been a real challenge for us getting enough information out on this because things are changing so rapidly. And you know, our world and our nation has changed dramatically over the course of a week. And I can't tell you what we'll look like when we get through this. But I do know that we as a country, we as a community have survived tremendous challenges before, and each time we have come back stronger. And I know Vermonters know adversity, and they know how to get through adversity. If there's any state that is going to come through this and be able to weather this storm, it is the state of Vermont. And for those of you who are fortunate to have grandparents and so forth, they can help advise us on how they went through this. And I think we can call on them and for their help at this time. And in the state of Vermont, I've been privileged to be here for the past 2 years, and with the hospital and the resources and the way this community comes together, there is no community that is going to get through this better than the community of Rutland County, Vermont. Thank you very much.
I'm Tom Donahue for Rutland Regional Medical Center. Thank you so much for being here today. For all of you listeners and viewers, we ask you on behalf of PEGTV and Catamount Radio, stay safe and stay Vermont strong.